Good afternoon, everybody. I'm Dave Kerner, County Mayor of Palm Beach County. Appreciate your attention here today. I wanted to make sure that we took an opportunity to communicate through the press, as we always do, prior to this weekend that we're going into. I know that we've been going through this process for some time, that it's frustrating, that it's difficult. I can promise you that I have the utmost confidence that the social distancing guidelines that we've been following and the very sincere and robust participation in those processes have been working. And I know that it's getting to wear on us as a community a little bit because you don't get to see the tangible results of the difficult work you all are doing in the community to make sure that we stop the spread of the coronavirus. But it is working. And I wanted to make sure that before we get into this weekend, I wanted you to know that there are plans for the future. There is light at the end of this tunnel. That doesn't mean that we're ready to transition to a different way of living life just this moment, but I know that it's on everybody's mind, and in fact there's an intersection of social distancing and recreational activities that will meet at some point, and that will result in a healthier, happier Palm Beach County as we continue to adapt to this new way of life. So I appreciate your attention, I appreciate your commitment, and just know that we are doing a great job as a county, and the results will be borne out by the data. And I believe that's starting to happen. And that commitment to making sure that we stop the spread or slow the spread, it goes beyond just public health and safety. It goes beyond just saving lives and saving the lives of your family, friends, and neighbors. It also will allow us to access what we all want, which is a robust economy once again, which is opportunities to have recreational activities in our community once again. But it's going to have to be in a way that is contemplated and sincerely sincerely abides by the CDC guidelines of social distancing. That is a new way of life. In that regard, I am joined to my left and your right by the Vice Mayor of Palm Beach County, Vice Mayor Weinroth, and to my right and your left, Commissioner Mac Bernard. The rest of the Board of County Commissioners remains very much engaged in this process, as do all of our elected leaders at the county and local level, and our public professionals that work behind the scenes with us. I want to give you some updates on some statistics and some insight into the current status of our order here in Palm Beach County with regard to non-essential businesses and restrictions on activities. Palm Beach County's order of non-essential businesses, public and private beaches, parks, boat ramps, public and private golf courses remain closed at this time. Let me repeat that again. Our private beaches, public beaches, golf courses, boat ramps, they are closed, and they are not opening tomorrow, and they're not opening on Tuesday, and they're not opening on Thursday. They are closed for the foreseeable future. The decision to keep non-essential businesses and public and private recreation closed is based on, of course, science and data. We're tracking the spread, we're tracking testing, and we're tracking results. We have doctors, we have a whole long line of people that weigh in on these decisions. They're not made in a vacuum, and they're not made for political purposes. Political influence, powerful people, industries, it's not going to influence my perspective and the folks that sit in the EOC who make these decisions. We're cognizant of the need to rebound economically, but the preservation of the unnecessary loss of life is the first and most fundamental thing of public safety, and that is the health, safety, and welfare of our community. Having said that, today I extended for the 6th time our state of emergency in Palm Beach County. This results in 35 days under the state local order of emergency. That is obviously unprecedented. We are, as most communities in Florida, used to being under a state of emergency for a confined period of time, usually a result of a hurricane or something to that extent. We're on day 35. It's wearing on the community. I'm sensitive to that. Each day, throughout the day, the health department and the emergency management professionals review data of the COVID-19 with local, regional, and state authorities. Today, I announce that unfortunately, there have been 113 people that have passed away in our county. Our hearts, our thoughts, and our prayers are with them and with their families and their friends. Many of them passed away without their family by their side. So as you continue to look forward to how we can get out and have fun again and get the economy back, both of which are important to our public health, please take a moment to remember that 113 people in Palm Beach County have passed away, and that number will continue to rise. and not to mention the passing of their death. Just like I did, I brought it up here in this press conference. Their passing has been repeated over and over again, and that's very difficult for the family. So please be cognizant of the loss of life, and know that but for your efforts, and but for your social distancing, and but for the burdens that have been placed upon this community, the number would have been much higher. And so we thank you for that discipline. As you're also aware, the governor of Florida, Governor DeSantis, has started to take a view to the future economic rebound of the state. This is an exciting prospect, and it's very, very important that this state rebound economically. And the governor has convened a very important task force related specifically to COVID-19 and the economy. And I can promise you that Palm Beach County will be well represented on that task force. I also want to address the fact that there are some jurisdictions to the north of us, namely Martin, St. Lucie, and Indian River counties, that have opened up a lot of recreational activities for their constituents. I can appreciate that they did that. I can also appreciate the fact that of those 3 counties, the aggregate total of citizens and residents of those 3 counties are about 40% of Palm Beach County in total. And so that decision that they make will not affect the decision-making process of Palm Beach County. In that regard, I want to remind you that we have 170 golf courses in this county. That is a lot of golf courses. This is the capital of the world for golf, and we're cognizant of that economic impact. But just like golf, just like beaches, just like parks and all the other recreational activities, we will open them up in a way that is medically responsible and responsive to the medical and health communities. In that regard, I would like to announce and alert the county today that I have been in conversations along with the county administrator, with the county mayors and administrators of Broward County, Miami-Dade County, and Monroe County, which is the Keys. And we have agreed, as we have in the past since day one, with the participation of the governor's office, that we will remain in lockstep as we repeal some of those restrictions on recreation and non-essential or non-critical businesses. What that means is, regardless of what the less urban counties to the north of us do, we have to look at our community as part of a regional area that includes the 3 major counties in Monroe. If we do something different here, and then they open up something different there, there's going to be the very obvious effect that people will drive to that jurisdiction to access those recreational opportunities. Again, in consultation with the governor's office, these orders remain in place, and as we repeal them, we will repeal them in conjunction with our urban neighbors to the south, and we will do it in lockstep so that there is an effective way of opening up recreation in our economy. Now, how can we get there the quickest? I haven't given you a date of when we're going to start this process. I can tell you that it will be after the anticipated surge, and the surge would mean the point of highest hospitalization in our county. We are well prepared for that. I will speak about that issue a little bit later in the week, next week. But we cannot contemplate opening up any activity that exposes us to COVID-19 prior to that surge. Job number 1, again, is the health, safety, and welfare of our community. And by abiding by these strict guidelines, we will ensure that there's never a passage of that surge capacity in our ICU availability in our county. So what can we do to get to that point quicker was the original question. First of all, get tested. We have a litany of testing options in this county. We've been fighting the same battle as every other city and every other county in this nation, in this world, quite frankly, to grab resources that are not readily available. But at this time, we have the FIT team of the Palm Beaches ballpark site up. That's a drive-through site. We have the South County testing site at the South County Civic Center. That's a drive-through site. We've just repealed some of the requirements to qualify there, and I'll give you the specifics on that in just a moment. We have a walk-up testing site in the western part of our county in Belle Glade. We have potentially a Walmart site. I'd like to announce that we hope that sometime next week Walmart will have a fully integrated testing site, drive-through testing site, with a very broad array of people that can be tested. That will be one of 50 national sites throughout the United States. We intend to have that sited at Belvedere on State Road 7. and that will be a site that is assisted by Palm Beach County Resources, but really ran from top to bottom by Walmart. And we thank the Governor's Office and the Department of Emergency Management for working with me and our county to site it here in Palm Beach County. Speaking to the South County Civic Site, Cleveland Clinic, operating the South County testing site, has expanded their criteria for individuals wanting to be tested for COVID-19. Now, anyone over the age of 16 who has a fever, cough, shortness of breath, runny nose, or gastrointestinal illness can be tested at the South County Civic Site. That is a drive-through site, and I'm going to give you the number for this. It's 561-804-0250. 561-804-0250. If you're over 16 and you have any of those symptoms, you can call that number and you can have a drive-through test accommodated for you next week. The Healthcare District of Palm Beach County has supported over 6,500 visitors to the drive-through site at the Fit Team Ballpark of the Palm Beaches since March 31st. Testing is open to any age, and you do not need to be symptomatic, and it's by appointment only, just like the South County site is, and here's the number for it. Again, any age, do not need to be symptomatic, but the burden is on you to go get tested. We cannot test you. You need to go and get tested. 561-642-1000. Again, Fit Team Ballpark of the Palm Beaches, 561-642-1000. I've alerted to you that in Belglade there is a testing site available for a walk-up basis only, and I've briefed you on the Walmart issue. I also wanted to take a moment to talk about our nursing homes. When you really look at the vulnerable population of our county, we have a very large vulnerable population, i.e. 65 and older. Probably the largest vulnerable population, certainly in the state of Florida, but probably throughout the U.S. in terms of per capita. Those are potential areas, as you've seen in the past, of devastation if not controlled and protected very carefully. To that end, we have been very proactive in protecting those communities. We have our own fire rescue has instituted its own program under our supervision to go in and test asymptomatic workers and healthcare professionals in those facilities to make sure that they're not bringing the coronavirus in, since it is typically a population that is immobile or does not leave the nursing home, certainly not under these conditions. And so we remain ahead of the curve on that, and that's our most vulnerable population. We need to be extra cautious with them. So think of them as you endure these difficult times and frustrations that you're going through. Continue to stay at home. Leave your home only to engage in essential activities. That hasn't changed. Practice social distancing or physical distancing. Keep 6 feet between yourself and other people outside your home. Wear a facial cloth when you're working in, patronizing, or otherwise physically present in grocery stores, restaurants for pickup. Definitely take the call already. All right, good. Definitely patronize your local businesses, your small businesses. They're the ones being hurt the most from an economic standpoint versus the larger corporations that can suffer through these difficult times until federal aid is available. Of course, all other persons physically present in any public space in Palm Beach County are strongly urged to wear facial covering as defined by the CDC. Remember, that's to protect people around you. It doesn't have to be an N95. It doesn't even have to be a surgical mask like this. It can just be a covering that you made to ensure that you're not transmitting your saliva to somebody else through droplets. We must not let our guard down. Again, to that end, Palm Beach County will be rolling out a phased restart to our recreational and economic positions. I will say that we are planning for a return to non-essential businesses. I've briefed you on that and the metrics that we need to meet, generally speaking, before that process will occur. And then next week, I do plan on delivering a State of the County address directly to your viewers and constituents of this county to talk about a long-term picture and what the next chapter of COVID-19 means for Palm Beach County. But I can tell you, as we get into the second phase, even though we're not there, we are close. And I'm proud of the work that's been done by our first responders, our health professionals, our employees, and I'm proud of this county thus far. So please keep up the good work. It's my honor to turn over the podium now to Ms. Virginia Baker, who is our county administrator. Thank you.
Thank you, Mayor. As County Administrator, I want to thank you for being here today, the Mayor, the residents, and especially the media, because you have done an outstanding job on carrying the message forward and scrolling it across the screens in the morning so that you constantly remind our residents that they should wear their mask, that they should stay home, and only come out when it's absolutely necessary. So I have to commend you for passing that message on and keeping it constantly in our residents' first thought of mind, so that we can continue to curb the tide and make sure that we're moving our people forward. Even though our numbers may continue to go up, most of our residents are abiding by the rule. And so therefore it could be worse than it is today. But I can tell you that as I'm driving down the road or I'm moving around in my community, I see the residents with their facial coverings on. I see the young people getting off of the bus with their facial coverings on. I see people going to work even in their cars with their facial coverings on. And so it is catching on. It is going to help us get back to normalcy as soon as possible. So please keep up the good work. And I do want to remind people, if you don't have to come out, do not come out. Only attend to the essential needs that's necessary for your day-to-day functions, such as going to the grocery store or the drugstores. If you have to go to work, then definitely go to work and then go back home. Stay in. It's safer at home. So we want to continue to push that message home. It is not my intention to strengthen any more executive orders as long as we continue to abide by the executive orders that are in effect. What we really want to do is start looking toward the future. We want to look toward the future. We're working with our neighbors to the south on once we meet the criteria for starting to relax some of our restrictions, that we do it in a systematic way, whereas we don't have people coming up from Dade and Broward to Palm Beach to participate in activities, nor do we have our people going south to participate in activities. We want to roll it out so that we can all get out and enjoy the natural areas, our open space, etc. We're going to slowly roll out releasing some of our restrictions that will be less impactful, and then we'll get a feel of how that works. We are going to work with our municipalities in Palm Beach County so that we don't have different rules in different locations within Palm Beach County. Palm Beach County is large as 2 to 3 states, and we've got 39 municipalities in the county along with the unincorporated area. So we need to have a unified front so our residents are very clear on what's allowed and what is not allowed. So as we roll this out, we will be working with our partners not only in Palm Beach County but to the south of us, and we'll share some of our information to our neighbors to the north of us as well, because that will make a huge difference. And so as we continue to plan for relaxing some of our restrictions, it will come in phases. It will not come all at one time. We will work with our business community in order to help bring back our business community as well. It will be an organized and systematic manner in which we do it, and make sure that jobs are coming back to our community as well. We want to stay safe, but we want to also continue to bring our economic impact back to Palm Beach County. That includes our tourism industry, which is really hurting, along with our restaurants. And so we want to make sure that we all come back together in a safe manner. The county will continue to work with you because you're our partners as well, and we need the media to help us continue to get the message out. And on that note, I'm going to turn it over to Dr. Alonso to bring you up to speed on what's happening in our community from the medical regard.
Good afternoon. How's everybody doing? Okay, I like that. All right, I'm Dr. Alonso, and as Director of the Department of Health here in Palm Beach County, I want to bring you some of the data that we're using to look at making wise decisions for our community. Our main objective, as it has been from the very beginning, is to utilize 2 strategies to stop the spread of COVID and provide contact investigations in our county. The first strategy is social distancing. You can see how well versed both our mayor and our county administrator are on this topic. I think they can speak it and say those words even better than I am. The second strategy is testing. Palm Beach County has, as of 11:30 this morning, tested 11,966 people with 1,867 positive tests. That's a 15.7 positivity rate as compared to Dade, who has 5 times the number of tests that we do, with 17.2%, and Broward, who has 3 times the number of tests that we do, with 11.7%. Our latest new cases for the last several days have been on 4/12, we had 54 cases. On 4/13, it went up a couple cases to 56. On the 14th, it went down to 47. And then we had a significant increase for 4/15 of 71 new cases. So our curve has been flat at times, but still having spikes. Our hospitalization have been steady, but our ICU utilization has increased, and so has the acuity, in other words, the death. We've had that 113 deaths. So Region 7, which as you heard is Palm Beach, Broward, Dade, and Monroe, makes up 30% of Florida's population, but yet 60% of the total cases for the state. And yet, while it's true that we have the third state with the highest number of tests, that's 24,119, that is less than 1% of our state's population of 21.48 million people. The University of Washington's Institute for Health Metrics is an organization that's doing projections, and they have predicted a surge for Florida in the first week of May. At this time, we do not meet the triggers to decrease social distancing. Those triggers include 14 days of decreased new cases, decreased hospital admissions, decreased ventilators, and readiness for all people to be able to be tested, just to name a few. Our community is working diligently on all these measures to help and continue to work with our local, state, and federal partners. I do strongly recommend that we continue to plan within our region and with all our partners, including our state and federal partners, and certainly with the governor, as we look into the future when these restrictions can begin to slowly get put into place. We cannot afford to jump the gun and risk a resurgence of the coronavirus, because that will delay the normalcy for even more months to come. So stay home, stay safe. Thank you very much.
Thank you very much, Dr. Alonso. I'd like to open it up to questions briefly, but before I do that, I'd like to offer my 2 colleagues, both Vice Mayor Weinroth and Commissioner Bernard, an opportunity to address their constituents, if either of you would like to speak. Vice Mayor?
You've heard the mayor, you've heard our county administrator, you've heard Dr. Alonso. We've invested a month in this now, and we're getting results. We're beating back this disease. We have dampened the curve. Our hospitals are able to handle the people who are coming in, and you're to be commended for what you've done. We can't let up right now. What we have done, we have accomplished together, and we can continue to accomplish this, and then we will get past this. So thank you, everybody, for what you're doing.
Thank you, Vice Mayor. We'll open it up to questions. Before we open it up, real quick, I just want to give one more plea to my constituents, my friends, and my neighbors here in this county to please remain resolute during this difficult time period. I know that it's wearing on all of us, but we need to keep up the good work. We need to remember the large picture here and understand that there is a light at the end of the tunnel, and the harder we work, the more quickly we will arrive at that point, and the more unnecessary loss of life we will have preserved. So with that, I'll open up to questions.
Mayor, on the nursing homes, could you elaborate on the methods the county is taking to stop the spread within those facilities? Is there an increase in testing, for instance, of the residents of those nursing homes, things of that nature?
I'm going to turn over to Dr. Alonso.
Our epidemiology staff, in conjunction with several of our partners, are going sometimes daily to the specific nursing homes. AMR has been a great partner in this. They're going out and doing surveys. They've done multiple surveys. We then go to the nursing homes, to the ALFs. We check on not only are they having any problems, do they need testing, do they need help, but also we check on their procedures. ACA has been here the entire time at the EOC in case we need any regulatory issues. We've also have a strike team that has been sent down from the state. We're using the strike teams also to help us go. And if we need any infectious disease administrative guidelines or anything, we have those people also available to help them go into those areas and help staff. Staff is very determined to help continue to serve the clients that they have in there. They're very worried about them, but sometimes they just need a little bit of help, and so we're providing that help and that assistance if they need it. We're also helping them with the actual testing. If they need additional PPE, we're also making sure that they order that and get that. So we're staying very, very much on top of the nursing homes because of the critically ill patients that they have in there.
Are there certain things you're telling the nursing homes to do that are beyond what you're telling others? Are there certain specific recommendations that you're giving to these nursing homes?
They're very specific for the nursing homes. That is different than the hospitals. So we're just going through those guidelines, making sure that they adhere. It's things as simple as making sure they have sufficient PPE, how they're changing their PPE, how they're going from room to room. It's very, very specific, and we're watching them to make sure that they're doing what they say they're doing. They're being great. They're really trying really, really hard to do this, and we're there to assist them if they need help.
You mentioned a study in Washington State that showed that there would be a surge in Florida in the first week of May.
It's called the Institute for Health Metrics. They're an independent group that does statistics. They use multiple points of information in order to statistically look at surges. They take all kinds of information, including what social distancing measures you've put into place, whether they're moderate, harder, or lesser. They also look at the data in terms of, this data that is available around the entire country, the number of patients you've tested, the number of people that are dying. All this information is available nationwide, and so they use all those different points of information to predict this curve of where you are in terms of the curve.
And it looks like Florida's peak will take place in the first week of May according to that model.
That's what they're predicting in that model. Now remember, that's a little bit similar to hurricane models. You just got to stay in the cone, right? So it's a good cone. It gives us some credible information based on that data. But just like the cone, we have to stay within those lines. It doesn't mean that on May 7th anything's going to happen. And like everything else that we do, we have to plan for the worst and do what? Hope for the future. Hope for the best. Absolutely.
One last question on that model. Does it offer any Palm Beach County specific information, or is it just state by state? I'm asking
The state.
I'm wondering will our peak be, will Palm Beach County's peak be May 1, that first week of May, or we just don't know?
It's the cone. We don't know, right? But the information is for the whole state of Florida. Now, again, if you listen to what I said before, our region is 60% of the data. So we should be somewhere in that cone. Hopefully. Now, we're always going to hope for the best, so maybe we've already peaked. That would be nice.
Question regarding, I didn't mean to interrupt you, I'm sorry.
No.
I just had a quick question regarding people can be asymptomatic and carry the virus but not show symptoms of it. How long are they, so to speak, going to infect other people before they're not infected anymore, I guess?
There's been a lot of studies being done on that, and to be perfectly honest with you, I don't have an absolute answer for you. I still believe that in order to spread it, you have to have your particles of the virus, which is in your nose and in your lungs, to come out of your body and spread that to someone. So a cough, maybe saliva. So if you are not symptomatic, where you're not coughing and sneezing, how are you going to get that out of your body? Well, perhaps it's in your saliva, perhaps it's in a cup. If you share a cup with somebody, you could spread it that way, okay? But it's going to be a lot harder. So most people are going to catch this by being next to somebody or having someone sneeze or cough on them.
Can I pick your brain one more time on nursing homes? Are you seeing any specific nursing homes that have a higher concentration of cases than others? Is it evenly distributed? Where are you with that?
There's a lot of nursing homes. We have over 250. It's not just nursing homes, it's ALFs and everything. I think they're pretty distributed. There may be some that have a little more than others, and we're going very specifically one by one to make sure that they all get the same amount of attention and the same amount of help if they need it.
In terms of capability, have you found any of you overwhelmed or
No, they're not lacking staff. Everyone's overwhelmed that's having people die, and, you know, just like health care providers and everybody else, this is very sad to see someone that you're taking care of for 2 or 3 weeks die. So the overwhelming is in the taking that total death over and over again. That becomes really stressful on a person, even people that are used to it. It's very hard to deal with. So it's a different situation than your everyday work, but not overwhelming in terms of lack of staff. Yes.
At the beginning of your announcement, you said there were just under 12,000 tests that were administered. 11,966. Okay. With the county at 8.5 million, how are you going to determine whether or not that curve is indeed flattening? Can you take our viewers through that determination process?
We look at the numbers every single day. So every day, the most important thing that I look at is the number of new cases. So it looks like we have a curve for Florida that goes up and starts to come down. The governor, I believe, has shown those curves. We have multiple models of that. Our daily numbers have not gone up as high as Miami. As a matter of fact, our numbers are below, but we've tested less people. But that curve has continued to look the same, even though we're testing more people. So we're confident that we're not going to look like Miami, we're not going to look like New York. But are we going to have a peak? I can't tell because I can't predict things like that. But our data is looking very steady. It's still having some flat and then a peak. That might simply be something as simple as the number of tests coming in that come in every few days. They don't come in every so many seconds. Sometimes they group them and put them in a bunch together. So hopefully those peaks have to do with testing. But so far, it doesn't look like, you know, we're definitely not going to look like New York, okay?
When it comes to the populations, the health disparity that we're hearing about more and more, what is being done here in Palm Beach County? We see the walk-up testing site in Belgrade. Will there be another walk-up testing site when the plans through?
Yes, that's one of the things that the county administrator, Virginia Baker, mentioned. One of the biggest areas that we're working on is health equity here in the county. Palm Beach County has been very aggressive in the social determinants of health and making sure that our vulnerable populations are looked at very closely so that we don't have those disparities. We are looking closely at the race, ethnicity. Right now, 60-some% of the people dying are white, non-Hispanic males. There's 8% that are white Hispanic males. And then the blacks make up even a lesser amount. But we have a lot of unknowns in that number. We're going to go back manually and go back to our EPI system and include those race and ethnicities that we have so that we can get that complete picture. There's several people looking at that, Palm Health Foundation, the Quantum Foundation, all those folks are working on the health equity issues, and I'm very much a part of that, so that is something that we're going to definitely be looking at. But we don't look like Louisiana, and we definitely don't look like Milwaukee or Detroit.
And is there a percentage of the population that would fall into the bracket of more of potential devastation? Is
Right now, the 66% is in the white, non-Hispanic population. That's the big death rate that we have. Also, the age. There's no doubt that the age, 92% is above the age of 54, with the biggest percent being in almost the 85 age group. So those people are the ones really taking the hit.
So at the ballpark testing site, the testing is open to pretty much anybody if you don't have symptoms?
Above the age of 16. They're not doing children, and they can pretty much go, they will ask them if they've been in contact, what is their concern, as long as they're concerned. So it should be something like, I've been in contact with somebody and I'm afraid that I caught it from somebody. What we want to make sure is you don't get tested unless you've been in contact for more than 5 days ago, because if you do it too soon, you don't have enough viral load in your body for the test to work. I know I've said that many times, but people still think, oh my God, so-and-so is here, I gotta run and get my test. That's gonna give you a false negative, all right? So you gotta wait at least 5 days, and that's gotta be torturous 5 days, but you gotta wait at least 5 days so that you can see if that test is really a true positive or true negative.
And for somebody who may have been asymptomatic and, they had it a couple of weeks ago and they got over it, and they go get tested, will that test show that they've already had it, or will it not show that?
No, that test will not, because that only picks up viral load. So after 14 days, your viral load will come down and you'll become negative again. What you need for that test is the antibody test. And so those are two tests that we want to get here as soon as possible. The antibody test and the rapid test. We're very close of getting those tests. Once we have those tests out, especially the rapid test, doctors' offices will be able to perform those, because that will not need the full PPE. That'll be a blood test that you take, and it's done very quickly. So we really want to get that going and get those in place.
For one more question, Doctor, I'm sorry. Forgive a broad question. We're usually supposed to ask pointed questions, but one broad one. What are the biggest impediments you're facing right now to combating this virus the way you want to within the borders of Palm Beach County, if you have any?
Continue, as hard as it is, the social distancing. People have to get it that even when we start relaxing the restrictions, social distancing is here to stay for quite some time. And I think we have to wrap our heads around that. It's not going to be back to normal like you do after a hurricane. We're going to probably still have to wear facial coverings. We're going to have to still look at people a little eerie, and be careful where we go and how we go. This is going to take a while until we get the vaccine, until we have rapid tests for everybody, until we can really know who we are dealing with, and making sure that we can isolate those people that become positive right away and their families. Okay, that's how we're going to make it go away. And of course, once we have the vaccine, then everybody's going to get the coronavirus vaccine, right? Even those people that don't get the flu vaccine now, you're all going to get it, right? Right. Okay. Thank you very much.
All right. Thank you, Doctor. And let me take a chance to respond to that question, that pointed and broad question. And the question was, what is the biggest impediment or struggle or hurdle that we as elected leaders have, or at the county level have, at combating coronavirus here in the county? And I agree with Dr. Alonso. It's not the lack of testing, it's not the lack of surge capacity, it's not a lack of resources. What I foresee as the biggest struggle is a mindset to the everyday person that this isn't going to affect me, and I need to focus on getting back out of the house and getting back to work. That's very, very important, and it's very true, and I understand deeply what the economic ramifications are and will be. And in my power, the Board of County Commissioners' power, we will do everything to lessen that impact. But if you are watching this and saying, I'm going to email the mayor because I want to play golf tomorrow, or I want to go on the beach and my civil liberties are being trampled on, folks, this is a state of emergency. Number one goal is diminishing the unnecessary loss of life. Once we get past that point, we are well prepared, and I will brief you more detailed on that next week, what the future holds for us. But the biggest impediment right now are people in this community that think this doesn't apply to them or that other people's lives aren't as important to their recreational opportunities. Yes, ma'am.
My last question is about the Walmart drive-through testing site. When should we expect to see that?
The question relates to the Walmart testing site and when it should be operational. Right now, the Walmart has submitted its application for a permit to the City of Royal Palm Beach. I'm hopeful that the City of Royal Palm Beach can move that quickly through. The goal was to have it up on this Monday. I don't foresee that happening, so we will continue to work with the city manager and the council to get that permit executed, and hopefully by the end of next week we can have that site up and running. We're also looking further to the future to doing walk-up testing more broadly in this county, or even into some of those ALFs and skilled nursing facilities and other communities that may not be in ALF, but there's a large density of elderly folks that we can actually bring the testing to them.
Any quick question?
Yes, sir.
About reopening the economy again. The president's been talking about trying to get everything open by the end of April, early May. Is that something you see as feasible, or are you going to be, kind of against that, so to speak, just for the ramifications it may have?
Sure. The question was, President Trump and his administration would like to see the economy open up by May 1st. I think that position has been walked back by the president in recent times, and I'll quote one of his staffers, which is Dr. Fauci, who said yesterday, this is not a light switch, right? So this is not going to turn on and off overnight, and it's not going to be broadly applied throughout the 50 states. The governor of our state of Florida, Governor DeSantis, has repeatedly said and said today that southern Palm Beach County, i.e. Miami-Dade, Broward, and Palm Beach, may have a different plan and pathway than the rest of Florida. So, we can't look at it as a national, day that the economy opens. We're going to do, in working with a governor who's very committed to this part of the state as he is the rest of the state, we're going to do, based upon science and medical data, what we're able to accommodate. And I don't think it's going to be May 1. All right, very good. I hope we all enjoy the weekend, have a safe weekend, have a socially distanced weekend, and let's remain very diligent in what we're doing. Thank you, everybody.